Thank you. Okay, so I'm presenting today about community-based education in Africa, specifically African medical schools investing in community-based education to increase the quality, the quantity, and the retention of their graduates. And the initiative that I'm talking mostly about today is the Medical Education Partnership Initiative. And so my role there is, while I'm at George Washington University, I'm part of the coordinating center for this initiative. And so the presentation today will talk a little bit about what is MEPI, how the MEPI schools in Africa are investing in community-based education, and then linking these community-based education efforts to quality, quantity, and retention of physician graduates. So first, a little bit about medical education in Africa. If you look across the landscape of medical education, even globally, you can see the stark difference. There's a dearth of training opportunities in the continent. Here we have 800 million people in sub-Saharan Africa with similar number of schools as in the US. And if we zoom out a little bit to the actual pipeline of physician training in Africa, I think you can see across, this is really for a moment just looking at physician training, while my presentation largely would apply to health professions workforce generally. But looking at the pipeline for physician training in Africa, we know there's a large deficit in the numbers. Yet if you look across the pipeline, there aren't enough going into medical schools. The enrollment is limited, the admissions is limited. If you look at the medical schools themselves, they have limited capacity and limited numbers. If you keep going, those who graduate, many go into the in-country brain drain, working for NGOs, working in non-clinical jobs. And then of course, we're all familiar with the brain drain that happens out of country. Up to 25 to 50% of graduates from African medical schools end up out of the country. So the Medical Education Partnership Initiative started in 2010, funded by the US government. It's a $150 million investment in the African health workforce. The themes of MEPI, which is the short form of the initiative, are three. First, to increase the quality and the quantity of medical graduates in Africa. Second, to improve the retention of graduates in areas where they are most needed. And three is to increase the capacity for locally driven and locally relevant research. Medical schools in Africa competed for their awards, and now the network of medical schools, because many of the schools who received the award built in-country partnerships, there's a network of over 24 medical schools in Africa. So looking across the pipeline and how MEPI is investing in this, we can see, broadly speaking, that the MEPI schools are investing across the pipeline. On the one hand, they're working with governments at both ends to address recruitment and admission issues, and at the other end, in terms of the conditions of service once the physicians and workforce graduate. But a large part of what MEPI schools are doing is looking at the medical school capacity and training programs. And while all of the schools who were awarded the MEPI grant were able to tailor their work plans directly to what their specific needs are, there are a number of areas that are areas of common interest and common activity. One of these areas is community-based education. And if you look at community-based education in the MEPI network, while it's one term, it has quite a broad interpretation, country-specific and at times even school-specific. So what I'm presenting today is really a look at community-based education in this MEPI network. And as these schools have started to form a network, it's become clear that there are two opportunities that have emerged here. One is the opportunity to identify what is CBE in Africa, what does it include, how is it being implemented, and two, how can we evaluate what CBE is doing to achieve these goals and what works? Of course, the latter is a more longer-term effort, but initially our efforts are to see and define what is CBE in the MEPI network. So what we've observed we are now actually coming to the end of 4 years in MEPI, so we've had 4 years of interacting with the schools, and we see that community-based education is defined very differently, but broadly speaking, we're defining it here as education that's happening outside of the tertiary hospital. And when you take that definition, you see that the schools vary in their approach and what they're teaching during these rotations. They vary in the length of time that students spend in the community. They vary in terms of who's teaching them. Sometimes it's the medical school faculty who go out to the community, and other times it's site supervisors. And even the location of the community varies across the network. So here's a snapshot, a little bit of a busy slide, but just a snapshot that shows you a little bit of where CBE is. As you can see, the majority of schools have rotations that are less than 6 months. So they're block rotations, typically less than 6 months, but there are a few schools, and we're going to be hearing about one of them soon, that have implemented longer term or longer duration rotations. Most of the schools teach clinical skills in the community, which vary from primary care skills to specialty skills. Most do research, most do public health, and more we're seeing the teaching of management skills in the community, where students and residents will accompany the site supervisors and have the opportunity to see how the facilities are run. In terms of whether the sites are urban or rural, we see a split. And the site supervision, as I mentioned, is often the medical school faculty, but also sometimes the site clinician. It's another graphic depicting the same, that most of the sites are rural, but many of them are urban. And since in many cases the cost of CBE is high, it's interesting to note that many schools are taking the opportunity to place students in urban areas where they don't have to pay for the accommodation and the transportation as much as the rural sites. So urban community-based education is an interesting thing to note in the network. What I'd like to do for the latter few minutes of the presentation is to take a snapshot of these 3 particular programs that have slightly different approaches to community-based education. The first is the Uganda MEPI program, which actually encompasses all 5 medical schools in the country. And their goal is really to train high-quality, comprehensive skills for their graduates, and to use CBE to increase the number of physicians who practice in rural areas. Stellenbosch University in South Africa is also using CBE to encourage rural retention, but has a year-long elective rotation. And in Nigeria, the University of Jos has used MEPI funding to invest in CBE slightly differently. They're finding that their tertiary hospitals are very crowded. So they use their funding to expand into the community, but training in the community hospitals. So sending their students for clinical rotations into the community hospitals. And ultimately, again, with the goal of recruiting physicians and health workers in the underserved areas. This is, again, a busy slide, but one perhaps for reference later, that the CBE has, while similar goals, the implementation of a community-based education in the different settings is quite different. And when we break it up, and really you could slice and dice CBE in different ways, but it really looks, though, that there are different types of experiences emerging, some that are really community health rotations, focusing on primary care, public health, and research. Others, as I described in Nigeria, that are focusing more on clinical rotations, even sometimes specialty rotations in the community. And others, a very novel approach that you're going to hear shortly from Stellenbosch is the Rural Immersion Program. And I'm going to end on this slide, which is a nice segue into the next presentation, which really talks about evaluation. And this is a longer term thing within the MEPI network. But how can we take this learning lab of very different approaches to training in the community, and how can we see how they link to the goals of MEPI, which include retention, quality, and better qualified workers? And I'll leave with one last thought that we're seeing now more and more as our community-based education programs are being scaled and strengthened, that there's certainly a contribution of these students as they train in the community. When we bring academic rigor and resources to the community, even the community benefits and the health facility benefits. So there are plans in place to measure those as well. Thank you.